Good afternoon. I'm Elizabeth Henry, President of the Environmental League of Massachusetts. ELM is a 121-year-old environmental advocacy organization based on Beacon Hill. And we've been advocating for Massachusetts to lead the nation in responsible environmental policy since 1898. We've long been a convener on environmental issues, and we're proud to continue our tradition in this new digital way. I'm delighted to welcome our nearly 400 registrants to today's webinar, joining us by Zoom, and those of you who are watching on Facebook Live. You, sprinkled around the Commonwealth of Massachusetts, include policymakers, business leaders, environmental advocates, social justice leaders, parents, teachers, and students. I admit I'm picturing each of you in your homes, and I hope that you are staying safe and healthy, and that your families are well during this unprecedented time. Welcome to this first edition of ELM's new weekly webinar series. This is the first of 10. We chose climate and health as our first topic for two reasons. First, there are profound interconnections between climate change and human health, as we all know. And second, because public policy plays the central role in determining how we manage the two crises, the crises of COVID-19 and the crisis of climate change. It's clear that proactive, science-based policymaking is essential to both. And it's also clear in painful ways how these crises place the heaviest burdens on those that are least able to cope. So here's what you can expect for the next hour. The next 20 minutes will be an overview from Dr. Bernstein, whom I'll introduce in a moment. We'll have 20 minutes of discussions with questions from the ELM team and those submitted by registrants in advance. And the last 15 minutes will be a Q&A from you, the audience. If you look down in the bottom of your Zoom bar, you'll see a Q&A button. You can submit a question anytime, and the ELM team will consolidate the topics, and Dr. Bernstein and I will respond. As I mentioned, this event is being broadcast on Facebook Live, and we're also recording these sessions. They'll be posted online to share the learnings beyond those who are able to attend live. We are so privileged to have Dr. Bernstein with us here today. Dr. Bernstein is the Interim Director of the Center for Climate, Health, and the Global Environment at the Harvard T.H. Chan School of Public Health, also called Harvard C-Change. He's a pediatrician at Boston Children's Hospital and an assistant professor of pediatrics at the Harvard Medical School. Dr. Bernstein focuses on the health impacts of the climate crisis, on children's health, and on advancing solutions to address its causes and improve the health and well-being of children around the world. Dr. Bernstein, we are so thrilled to welcome you.
I really want to take the opportunity to thank all of you who are stuck in various parts of the Commonwealth, as Elizabeth alluded to be on this webinar today. I hope the next 20 minutes or so I can give you a sense of what I've been thinking about as I straddle the worlds of dealing with the pandemic and direct patient care to thinking about climate change and other environmental concerns. But the short of what I want to tell you is that it turns out that actions to prepare for and prevent pandemics are climate actions. And that may not seem intuitive right now, but I hope I can make that case. I hope I can also be clear that the time to be talking about climate solutions as pandemic solutions is right now. You know, if you go to a hospital with a heart attack and you need blood going back to your heart, you might not want to talk about how to prevent the next heart attack while you're, asleep on the catheterization table, having your blood vessel reopened. But you can rest assured that not too long thereafter, there's going to be someone talking about diet and exercise and smoking and what we can do to prevent this moving forward. And that is as true in that moment as it is now. So the first point relates to some research that colleagues of mine at the Chan School put out this week, which confirmed what we suspected based on prior research, that air pollution, and especially particulate matter air pollution, is increasing the risk of people dying from COVID. And, that's not terribly surprising, as I alluded to, but what is somewhat surprising is that in this study, which looked at COVID around the United States, it found that very small differences in air quality and particulate pollution on the order of 1 microgram per meters cubed. And to put that in context, the particulate matter in Boston today is somewhere between 5 and 10 micrograms per meters cubed. That can increase, 1 microgram per meter cube increase in particulate matter can increase the chances of dying from COVID, the mortality rate, by 15%. So we have this study, we have another paper out of Italy from their experience. And then, of course, we have emerging news that minorities, particularly African Americans and possibly Hispanics as well, may be dying more often from this disease. And we know from past research that minority populations, particularly African Americans and Latinos, are more likely to be exposed to air pollution. And so we need to understand more fully than we do whether the impacts of air pollution are frankly making worse the health disparities we already know about. This also makes clear, of course, that reducing the sources of that air pollution, which certainly in Massachusetts and in most places in the United States is from burning fossil fuels and increasingly from transportation-related emissions, isn't just good carbon or climate policy, it's really important health policy. And we know that particulate matter is, of course, bad for all kinds of health conditions. But it's now clear that it may be a real player in what happens when we have respiratory pandemics like COVID. So that's what I mean in part when I say climate solutions are in many ways pandemic solutions. Let's talk about another dimension of this, which is that we know that COVID is much harder on those with pre-existing medical conditions. Things like high blood pressure, heart disease, lung diseases, diabetes. People with these conditions are much more likely to have a harder time with the infection. And in the United States, we know that main drivers of these diseases relate to diet and exercise. So right now, about $200 billion a year are spent on treating obesity in the United States on an annual basis. When I started in this work as a doctor, rates of obesity among adults were somewhere around 5%. Today, they're closer to 30%. So these are 25% increase, or more than 80, maybe 90% of our problem has to do with changes in diet and exercise. So what are the changes we need to make to diet and exercise? Well, for exercise, what's interesting is that Americans at least assert that they're exercising more than they did 20 years ago. The difference is we're also sitting in cars longer, and our commutes have changed, and our commutes, of course, are heavily car dependent. And there's evidence out of large population studies showing that how we commute both to work and to school can really matter to our weight and our body mass index. And so we advocate for all kinds of reasons for people to have greater access to public transit. And to be clear, public transit in these studies does affect or strongly suggests that it affects people's body mass index. But of course, so too do bicycling and walking and other forms of active transportation. And so in this regard, moving towards more active and public transit is good for our health right now. It improves the population health status that when something like COVID happens, and if you don't think there's going to be another COVID in our lifetimes, I'm sorry to tell you the odds are against that. It also, it makes us resilient to diseases like COVID, because when we're obese and have all the medical complications like heart disease and diabetes that come with it, we're more vulnerable to it. And of course, these are climate solutions. We know that a lion's share of carbon emissions, particularly in the Commonwealth, have to do with transportation. Those are two examples. And let me give you one more, which also connects to healthcare. So, and this doesn't focus so much on the prevention side, it focuses on the resiliency side. So what we see happening with healthcare in the Commonwealth right now is that we have disparities in access and disparities in utilization. So some hospitals are busier than others in the same city of Boston, and some folks have more access to care than others, which the latter point is nothing new under the sun. But what happens when the healthcare system is strained and some hospitals have more patients banging at their doors to get in than others is there needs to be a pop-up valve, and where are patients to go when we have excess capacity. And what we're realizing is that even in Massachusetts, where we have arguably one of the best insurance safety nets in the country, we still face the same challenges that come with our fragmented approach to health insurance and medical care, and that people often are stuck within the bounds of their insurers and their provider networks, such that it is difficult to safely transfer care across institutional lines sometimes, and also to get access to care that is covered by insurance. So what does that mean? That means that a patient who's in the partners network may have a harder time getting into the BI network and vice versa. And the records may be harder to get to and from. So we can do more to make sure that medical records and continuity of care in general are streamlined for circumstances like pandemics. And that would be helpful. That would also be helpful with climate change. You know, we see time and again with hurricanes, and you know, we're not immune from hurricanes in Boston by any means, that hospitals are mostly working, and the research supports this, to essentially figure out how to provide care within their walls. Do we have enough supplies? Do we have enough staff? Do we have backup generators? And that's obviously all critically important. But what we see from experiences like Harvey and like Sandy and others is that as challenging as figuring out what to do within the walls of a hospital are, transfer of care is an enormous challenge. And again, particularly for those who may have vulnerable health at baseline, and also may not have the best insurance. So when we design more resilient healthcare systems that we're able to deal with crises like COVID or hurricanes, we'll get benefits across the board, and that involves portability of medical records, as well as access to care across insurance networks. As many of you know, we're struggling right now from out-of-network, and this is, again, hopefully more a problem not for the Commonwealth, but I'm sure it happens here too, which is out-of-network charges, which happen to the surprise of many. So there are many more ways in which the actions we need to take on climate are also things we need to do to address things like COVID, and that's as true in most cases in the Commonwealth as it is across the country. I think taking a step back, when we ask questions about COVID and why it's here, it makes abundantly clear that we have to seriously consider what we're doing to the climate, as well as to the living world, the other organisms we share the planet with, because we know that both of those forces are foundational to the spillover of pathogens from wildlife to people. And, you know, nature has given us a couple of shots over the bow here. We've had HIV, we've had pandemic influenza, we've had now COVID, and those are all within recent memory. And there are others, all of which emerged into people from wild animals, in the case of influenza, both potentially wild and domesticated animals. And that, you know, nature is really trying to tell us something. So in the context of Massachusetts, one might rightly say we're not a big part of this puzzle in terms of carbon emissions or how wildlife is being trafficked across our border or overseas. But there's no question in my mind that if you look at, for instance, the Clean Air Act, which is just been an extraordinary success in terms of how it has both benefited the environment and health and the economy, that individual state actions have a critical role. The Clean Air Act was not a federally designed idea. It resulted from individual states taking actions to improve their air quality, which forced the hand of federal policymakers to do something together. And that's the pathway we could see carbon policy taking shape. California obviously has a robust carbon policy. We're a part of RGGI, working on the TCI, the Transportation Climate Initiative. And the more that these policies take root and the more effective they are individually, the more likely we may be to see accelerated change across the board. So with that, I would be happy to take a step back and go through some of the questions that folks have raised, and then of course turn to questions from those listening in.
Perfect. Thank you so much, Dr. Bernstein. We got a torrent of questions for you from our registrants, and I see many more coming in through the Q&A box. So I'm gonna try to bucket these into a few themes first. First, obviously, building on what you said about transportation, it is the single largest share of greenhouse gas emissions in the Commonwealth, and nationally, it's also a huge driver of particulate emissions, particularly in urban areas. That research that you modestly referenced for those listening was actually covered in the New York Times this week, and so we'll send out a link to all the registrants. At the federal level, in the middle of the COVID-19 crisis, many of those listening, and certainly the ELM staff, were troubled to see two major rollbacks at the federal level on environmental protections. The Trump administration has directed the EPA to stop enforcing environmental regulations for the foreseeable future, with sweeping consequences. And second, rolling back the clean car standards. Can you talk a little bit about the magnitude of the health consequences of these actions?
It's a good question. I don't think we yet know, although I think the CAFE standard rollback is, at least in some ways, more predictable than the more recent announcement, or the somewhat simultaneous announcement of the changes in enforcement. Air pollution from cars and trucks in the United States is substantial, and even with the improvements in fuel efficiency, we still see remarkable burdens of disease from traffic-related air pollutants in the United States. And again, this is a disproportionate thing, because we know that people living next to freeways, and particularly just downwind of freeways, are much more likely to bear the effects of this pollution. But in my line of work as a pediatrician, the best available science shows that right now in the United States, 1 in 5 children who develop asthma develop it because of exposure to traffic-related air pollution. Now, the number of children with asthma is changing for many reasons, and it is absolutely true that air pollution as a whole is going down. But at the end of the day, we have to deal with the reality, which is we're giving children asthma who would never have had asthma because of burning fossil fuels around their homes and schools. And so the CAFE standards are, going to make air quality worse. And we can speculate about what the lack of enforcement means, but the reality is, for the last 3 years, for the first time in decades, air quality has gotten worse in the United States. Not entirely clear why, but it's a very concerning trend, because number one, it's going to cause more harm to people, particularly, vulnerable people like the children I have to take care of. But two, it's financially foolish. I mean, the crazy part about air quality in the United States is that when the Clean Air Act really took hold some decades ago, arguments were raised that it would be wildly cost ineffective, right? That it was going to be way too expensive to do the measures that were needed to reduce air pollution. Well, that was grossly wrong, because the conservative estimate is that the return on investment for the Clean Air Act over the past 3 or 4 decades is about 30 to 1. And that doesn't even include children in those assessments. And the more we look at air pollution, and I think this study on COVID is a good example, the more we realize that even low levels of particulate pollution, which again is mostly transportation related, can have, and this is within EPA standards, forget about the enforcement, current air quality guidance, have major effects on people's risk of health. And so really the question becomes, are there alternatives that are cost effective that we wouldn't have the air pollution? And it would be one conversation if we said, well, there's really nothing else out there to power our cars and to give us electricity, but that's not where we're at, and it is mind blowing to me that, given all we know about air pollution and all we know about greenhouse gas emissions, that we have a grand total of 5 offshore wind turbines off the New England coast in one of the most productive, wind regions in the country. This is almost inconceivable to me at this moment in time. So, I think there's a lot of reason to pay closer attention to what's going on in terms of air quality enforcement. But even without that, we have the recent past history of worsening air quality. We know transportation emissions matter to all kinds of diseases, including asthma in children. But of course, matters to adults as well. And then we have a reality, which is we have been stymied in measures that really accelerate the renewable energy we need. Because for us in Massachusetts, you know, we can do solar, but we're not Nevada. What we've got in spades is wind power.
You got it. Well, offshore wind is a huge priority for the Environmental League. And, you know, your comments about asthma certainly land with me. 13% of our children in Massachusetts suffer from asthma, including my son. And I'm living this too. You know, Dr. Bernstein, so much of your research has been on air quality, but I would be remiss to overlook what has been a waterfall, pun intended, of questions about water safety and water health during COVID-19. And so if you could briefly just address two themes of questions about the relationship between water quality and human health in this moment. People wondering, how can we protect our water supplies and those that work from water treatment plants from being exposed? And are current drinking water treatments sufficient to handle new waterborne infectious diseases?
Yeah, so I think there's good news on several fronts there. One is that, to my knowledge, there's no evidence that COVID is transmissible through water. It may come out later that it is. But right now, you know, looking at the disease as it's spread, it does not seem to be spreading through water networks. It seems to be spreading through interpersonal contact. The second is that the virus itself is not really that robust, right? So there are some viruses that there's some evidence that they can make it through water treatment, but largely viruses are pretty well killed by standard water treatment facilities. The problem, and I think some of these questions get at, is in the era of climate change, we have greater stresses on our water systems. So in, you know, for example, the Charles River, as pretty much anyone who's been paying attention knows, is just dramatically cleaner than it's been in a long time. And that has to do with essentially the prevention of runoff into the river, either over land. So, you know, this is planting trees in green spaces that absorb water, and from direct storm pop-offs. So it used to be that when it rained really hard, instead of water being diverted to Deer Island, it got diverted into the Charles River and the harbor. Well, that's great for the river, but the problem there is that our pipes are only so big. And so, you know, with unprecedented rainfalls, and we know from our climate assessment, the National Climate Assessment, that rainfall events have gotten more heavy in Massachusetts, New England, than anywhere else in the United States. And so there's an even greater need to increase green space, to reduce impervious surfaces, and importantly, to make sure that the capacity of water filtration, and this is for all pathogens, is where we need to be given what we're seeing with climate change. But it's you know, the odds of waterborne disease are there. We've looked at data that shows that with heavy downpours, there are more outbreaks of waterborne disease. That's for a variety of reasons. And so we can see that coming. And so that makes clear to me that the preparedness needs to be there around our water systems.
Thank you. I think you've just put some people to ease, or people's minds to ease. You have been interviewed and spoken quite movingly about climate denial and virus denial and some of the eerie parallels between the two. How do you think that this COVID-19 crisis is going to change the public's relationship with science and respect for scientific expertise?
Yeah, so it's a really important question right now. You know, it wasn't so long ago when the idea of a post-truth era was being widely circulated as a new normal for American society, that there were sort of multiple equally valid realities. And to those of us in science, that was particularly worrisome, because I think we see, and certainly others do, that when you look at any number of things that we consider good that have happened in our country and around the world, they're the consequence of science. That the reason we have vaccines, the reason our cars are safer, the reason we're able to go to the moon, this is not by wishful thinking, this is by experimentation and knowledge. And so the idea that science is just another belief system makes us concerned that we might actually cede progress in ways in which people really would not be better off. And so let's put that in the context of COVID. And you know, there are many who have said that there's been a growing trust in science, that there are Gallup polls showing that 70+% of Americans trust scientists to deal with COVID. Well, that's good news. And then, the remainder of people say, what's the remainder? It's family and friends, which is certainly understandable. So that's, it's somewhat a comfort to me to recognize that we haven't gotten completely untethered from science. So the question for me is what does that mean to the climate, the questions around climate change? How is it that the engagement with science on things like a pandemic can be so clear and so forceful, and not those same attachments apply to something that is equally scientifically founded? And I think that's kind of on us. I think that's kind of on the scientific community and people in public health, because we haven't actually, I think, done a good enough job at making that science personal and clear and actionable in the same way as when scientists say we need 6 feet and we need to hand wash, and here's how it's transmitted, and here how it affects your health right now, and here are things you can do right now to make yourself safer and healthier. That it makes it much easier to push aside. I also, of course, recognize that everybody's familiar with infectious diseases. Climate change is not a paradigm that really fits in the wheelhouse of people's everyday experience. And so when you deal with pandemics, people sort of get that there's germs, they're transmissible, and there's a framework existing that is pretty robust that you can work with. And with climate, we're playing catch up in that regard. But again, we can learn something from COVID, which is, we don't like pandemics. No one likes pandemics. No one likes losing their job, and no one, likes the uncertainty that it brings. And then you say, okay, well, what if I told you that pandemic prevention starts with climate action? That we know that climate change is driving risk of disease emergence. And and the challenge we face, in addition to the issue of not having a sort of familiar framework, is climate, of course, is politicized in this country. Can you imagine if infectious diseases were politicized, that the germ theory of disease was, your endorsement of this was dependent upon your political ideologies? That's sort of what we're dealing with climate change. And so the task of folks like me is to depoliticize, to say, you can have ideologies about whether you like government or not, but if you actually care about your health, you need to hear from people who know something about this, that this is going to determine whether you live or die. It's going to matter to your children's health, and it matters right now. And this, again, isn't so much about the long-term effects of climate, although it certainly is. It's about what I was just saying, which is fossil fuel burning is making people sick. And stopping burning that fossil fuel is going to make people healthier right now, and especially those people whose health is most at risk. So I do think there's a lot of stuff to learn from COVID and how our society is responding, and how science can be brought to the fore. It is not that it is a small challenge by any stretch, but I do think there are important things to learn.
Great. I really liked what you said a few minutes ago about climate action being one of the solutions to the pandemic. And I wanted to, we may have our toes on the edge of just some unprecedented stimulus and policy making in the months ahead, as our federal government and state governments figure out how to put the country back to work and protect the public. From an environmental perspective, what do you see as the greatest policy opportunities coming out of COVID-19?
It's a really good question. I think that there are many. I think one of the things is, that's immediately clear to me relates to transportation. So people aren't driving right now. And one of the things that we might recognize is how are our work lives potentially doable in the absence of everyone sitting in a car for long periods of time every day. Now, how to operationalize that from a policy standpoint is longer term than what could be done necessarily in the immediate term. But should funds that are being dispersed to states be used to improve people's access to public transit, all the measures talked about? Absolutely. when systems shut down, there are all kinds of problems, but there are always opportunities. A good example of that is Sandy in New York.
I have one more question, and then I'd like to pivot to audience questions because we've got a lot of great ones here. Climate change is kind of the ultimate public health crisis, and it is already beginning to be upon us. Over the last couple of months, the country and the world have begun to demonstrate the power of collective action to flatten the curve on COVID-19. And we got a number of questions from attendees saying, how do we flatten the curve on climate change? Is there a parallel that we can carry forward?
Well, it's a reasonable analogy. I would argue in some ways we are. Obviously, it's not happening nearly as fast as one would like. But I think at the core of the question of what needs to happen to accelerate actions in this country is that we need to bring the issue down to size. We need to put forward the evidence that shows that climate actions make people healthier now in the communities they live, and particularly those who are most vulnerable. We talk, climate change is certainly a public health issue. And I'm at the Harvard School of Public Health. I'm a medical provider, and I, there's not a clear line in the sand between public health and medicine, but there's some real differences. And public health is really geared towards preventing stuff, which is if there's any situation in which prevention would have been really helpful, it's this one. I mean, think about the 7 point whatever trillion dollars the world governments are spending after the fact, and what a fraction of that could have done to prevent the need for $7 trillion. So, we need to make this more of a kitchen table issue, and not by trying to fit a square peg in a round hole. We know that actions like taking fossil fuels out of the transportation fleet are going to benefit people's health right now, particularly those who are most disadvantaged. And we know that, more exercise, more access to green space, pretty much all of the things, eating less red meat, all these things that we need to do to address climate are actually very good for people's health right now. And so we need to find the communication, and not only the messages, but the right messengers to talk to people where they're at. I think we make a big, we don't do ourselves a lot of good by broadcasting public health messages to populations for which public health actions are not unimportant, but aren't nearly as critical as whether they're going to have food on the table or a paycheck. So I think that this really, and COVID makes it clear that when there's a crisis in front of us that affects our health today, people do extraordinary things. And I think that's where we need to increasingly move in the climate conversation.
So I'd like to pivot to some of the audience questions here. One about transportation. Obviously, the 44% of Massachusetts emissions come from tailpipes. How should we reconcile this very real possibility, asks a listener, that people will be much more cautious about using public transportation in a post-COVID-19 world?
Yeah, I think it's a totally legitimate concern. I think the reality is that there may be good reason to keep people from crowding for a period of time. And I think that the challenge will be who's deciding when to sort of fully endorse people getting back on public transit. And I think that has to be guided by science. So we need to understand the rates of circulation in the community. That means we need testing. And then we need people whose expertise really focuses on the spread of this disease to really help us understand when the right time is. When that time comes and the science is clear, then we need our leaders to show the public that this is okay to do. We need leaders taking public transit. We need folks endorsing this and making clear that this is something that's okay. And we need the medical community to show that as well. I think that's the pathway on public transit. So, we need to be careful. And again, it's just another example of why having data and science are so critical, because you don't want to make that decision in a way that exposes people to risk. And we know that people who use public transit are often folks who are extremely vulnerable from a health standpoint. So you don't want to set them up for having a bad outcome because we were pushing back to public transit too quickly. Now, of course, if we had access to like walkable communities and more bike trails to those who use it, that also would be helpful to getting folks back to work without using public transit.
We have a question about COVID-19 and increasing the climate commitments of nations around the world. A listener writes, do you think our current experience with COVID-19 will induce the nations of the world to address climate commitments because they see the potential damage to global threats more clearly?
We can certainly hope so. I think that if you look at around the patchwork of commitments from the biggest polluters when it comes to carbon around the world, the obstacles in the way I think are somewhat different. The United States versus the EU versus China or India. I think the obstacles are different, and the question is what is going to motivate folks to accelerate change? And I think there's a different answer to that question based on where you're at. To me, the sort of most important thing to recognize, and I doubt this is news to anyone on this webinar, is that there are all the health reasons and then some that I've alluded to take climate action, and then of course there's the climate reasons to take climate action for the long term. But those, of course, run into people saying, well, if the United States went to zero carbon, it wouldn't matter if China didn't do anything. And there's some truth to that, but that really misses the point. When places lead, like Massachusetts has and other states around the country, on solutions to this, it is the biggest economic juggernaut of our lifetime. And that's because pretty much everyone who hasn't had a frontal lobe lobotomy recognizes that we have to fix this. I mean, you pick the sector, religious, military, certainly scientific, health, and any other possible one. People recognize that this is a huge mandate for society. And so the folks who come out ahead are the folks who innovate the most. And so that sort of makes the conversation moot, because if you have, for example, a new wind technology that's much more efficient than the old one, and it produces wind energy cheaper than something else, it's going to be bought here, and it's going to be bought in China, and it's going to decarbonize China, and it's going to decarbonize here. The Chinese don't want coal necessarily, as they have coal. And as many people know, they have more renewables going up than we do by a long shot. So this is really a race to who wins this century in terms of health and in terms of economic opportunity. And so my optimism comes from the reality that we have people in this country who are pushing on this really hard, and the more the better.
Yeah, well said. We would, here at the Environmental League, we would like for Massachusetts to do for clean tech what we did for biotech, to be the best place in the nation to start and staff and grow a firm that solves some of these climate and environmental problems. So thank you. Well said there. So we have, I believe, 114 colleges and universities across the Commonwealth, and someone listening in who works for one of them is asking a question about how she makes the case for climate action. She writes, I work for a post-secondary institution, and I'm trying to convince our executive team to invest in climate change planning and mitigation strategies. Can you provide any advice on how I make the connection between climate change mitigation and COVID-19 to these post-secondary leaders?
Well, you can certainly reference the research that we talked about earlier in the webinar, that air pollution, which is from fossil fuels, which cause climate change, is increasing risk of people getting really sick with the disease. That's easy. I think that having worked on, I was on Harvard's climate change task force, and I've talked with colleagues at other universities who've worked on their climate change task force. I've seen a fair view of the landscape of what institutions in higher education face, the landscape of what they face as they try and do this stuff. And the arguments are hard to localize, right? So what if a university invests in renewable energy? How does that really benefit them? And I think the health arguments have often to do in the transportation space. and that's as true for the students as it is for the faculty and the staff. Of course, it depends on whether you're talking about an urban campus or a rural campus, but nonetheless, there's some real issues there. Certainly diets. So I think if universities and colleges have as their mission to something along the lines of educate future citizens of the world, what's served in dining halls really matters to students' learning. And there are huge learning opportunities. Now, we also see blowback from students who say, I don't want my lunch to be an educational session, I want it to be lunch. So you don't necessarily have to throw it in their face, but you can certainly do a lot in that regard. And simply, that there are either formal educational offerings or informal offerings that connect the dots here for folks about diet and health, which is, as I alluded to, a huge issue in the United States, and of course, climate. And lastly, I think in the spirit, and to me, the connections are trying to get at the core values of higher education, which are learning and research. And so, around the learning point, one can make the case that it's hard to have an educated citizen in the world who doesn't know anything about climate change. And on the research point, this is where, setting metrics and achieving them are really important because you have data and can measure it and show progress. The challenge in doing all this, of course, are resources, money, and people. Especially these days in higher ed, most places are not looking around for new things to do that cost money to take more people. And I recognize that. And I think in some ways, we've seen progress through partnerships. So you see constellations of universities and nonprofits getting together to do this. You all may know that the largest renewable energy purchase of nonprofits in the country was between BMC and MIT. And as one example, there are now such cooperatives around food, so around food literacy and dining services. And so I think to the extent that there's obstacles around individual institutional capacity, there are plenty of places to find partnerships. And because we've got, Elizabeth was at 114, there are lots of people to reach out to in the neighborhood.
You mentioned earlier in the conversation working from home and how how people may be getting more comfortable and kind of in the way that we are today with engaging virtually and with potentially longer term impacts on transportation and congestion. One of our listeners wanted you to expound on that, and they write, in light of the change to working from home during this pandemic, do you see a possible great opportunity to change the way we work and live by making commuting to work an old-fashioned idea? Might this finally decentralize our world?
Yeah, I really like that point because I often talk about how there are no spittoons in the State House. You don't see people spitting, chewing tobacco into spittoons on the floor. And if you stop and think about that for a second and ask, well, why are there no spittoons on the floor? It turns out that there are no spittoons on the floor not because there was scientific evidence showing that chewing tobacco was causing cancer and all kinds of other health problems. There are no spittoons because people thought it was gross. And so we think, sitting in a scientific institution, it is always the default proposition that we need more science to figure out how to do stuff better. And there's some grain of truth in that. But with things like climate change, what we may need science, but maybe it's not the hard science of biology. It may be more the science of anthropology and psychology and sociology and economics, because what we really are asking for is a change in cultural understanding of an issue. There's still some people in the world who think the earth is flat and have tried to do experiments to show this to others. And so we have to recognize that, to your example of, can we make commuting to work seem old-fashioned? I think there's still probably value in getting people together in real person. But it really, in my mind, raises the question, what would happen if we had, instead of, as I look out in my commute on a bicyclist, I'm a bicyclist in Boston, every day, instead of having 80% cars, we had 80% bicycles. And not that that's going to happen in my lifetime. It would be nice if it did, but it's probably not going to happen. But the point is that our understanding of what is normal and what is culturally accepted has huge influence on people's uptake, and it often is regardless of what it even means to our own health. So more Americans recycle than vote. Why? Because no one wants to be the person on their block without the recycling bin on the curb, because of the reality that it's the culturally normative thing to do. So the college food scene, as I alluded to, is an opportunity. How we design our infrastructure in Boston and the Commonwealth of Massachusetts matters. You know, people say, well, you know, bike lanes on the street are not safe for bicyclists. And I'm the first person to say that. But having a picture of a bicycle on a street is better than nothing. It doesn't necessarily make bikes a lot safer, but it shows people that, in fact, we're living in a community in which there are bicyclists. and people who wouldn't have been thinking about bicyclists are now confronted with this reality. Many people may not like that. But again, this is where good policy making matters. I mean, I'm stunned in many ways at like workplace incentives, which still to this day give people huge subsidies for driving. I mean, parking discounts of hundreds of dollars a month, and these same organizations won't do anything for bicyclists, nothing, or for that matter, even public transit. And so, you know, is that the responsibility of people in government to address? Maybe, but at least we should be having this conversation, which is, why are we incentivizing things we know are bad? And you know, I need to be sensitive to the reality that many people who are driving have no choice, and that many people who are driving the first are the least well off. So, you know, again, we need to acknowledge that, you know, simply telling people not to drive may in fact disproportionately harm the poor. But at the same time, there are plenty of folks who have lots of resources who are getting lots of subsidies to drive. And that to me is bizarre.
Picking up on a couple of listeners have questions that pick up on messaging, and also some of the subtle but real differences in sort of the temporal challenges here. You've got this really immediate crisis of COVID-19, and then you have arguably a larger crisis of climate change, but spread out over time. Picking up on that temporal piece and circling back to messaging, a listener writes, quote, your point about meeting people where they are is crucial to both the current crisis and the climate crisis, and it's one that I feel continues to be overlooked. What can we be doing right now to fix this? How do we help people in disproportionately affected communities, in other words, communities really hit by COVID-19, make some of these changes when they don't have the same resources that other communities have? So, you know, linking to messaging and to some of these really cruel and disproportionate impacts for those least able to cope.
Yeah, well, I think you know, messaging, you know, is critical, and I referenced and didn't spend enough time saying that the messenger is equally important. You know, real change comes from within communities, and those communities may reach out for guidance or support, but it really does need to start from within communities. And you know, the example I like to give is, if I went to Oklahoma and started talking about how climate change is so critical for the health of Oklahomans' children, as you know, accurate as that may be, I have no moral authority in Oklahoma. I'm an elitist, snobby, liberal, and I'm not that liberal, just for the record, because I'm from Massachusetts. Prius driving, you know, New York Times reading, whatever other, you know, point of contention may be, and therefore I don't really share values, nor do I look like the people I'm trying to talk to. And I think some of the things I've seen from the city of Boston around climate, I think get at some of the core ways in which governance can really help here, which is empowering communities to figure out climate solutions, to raise them up from within the community, and providing incentives for community leaders to engage on climate and leverage the existing community structures, I think is a brilliant way to approach this. I think we need, I mean, environmental justice remains to this day an issue that profoundly affects the poor and people of color, who are not represented in the ranks largely of those advocating for environmental justice. And you're looking at the poster child of this problem. I obviously am not going to stop recognizing I may not be the right messenger here, but have we really, so often, because we don't listen well enough, we don't realize that the needs of the folks who we're supposedly trying to help the most are not the needs that they themselves would articulate. And so, it's just this may seem obvious, but being really good listeners here is the surefire path. And as a clinician, I don't have any more hair to lose, but I can tell you that and this is not far from the truth. I've taken care of children who have run-of-the-mill infections on their skin. And the parent of that child, the grown-up of that child, will say, I don't want to treat that with antibiotics. Now, usually it's the other problem, which is the parent wants antibiotics, and I don't want to give them. But that child's infection is easily treatable with antibiotics. We know this from lots of research. The antibiotics are not particularly toxic, and the course is not particularly long, and the parent says, I don't want it. Well, the way we tend to operate in the environmental movement is too often just repeating that the child needs antibiotics, rather than trying to grapple with the understanding of that parent, which is in many cases, in my experience, very well-founded concerns about why they don't want to do this. Mm-hmm. And we can give every reason under the sun to try and move forward the way we want to, and it ain't going to matter until whatever is driving this, this concern is surfaced. Right. And I think that's the same reality with climate action. People fear in parts of the country that this is a loss of their independence. People are fearful of science that portends understanding the future in ways that seem impossible. People fear they're going to lose their livelihoods, that there's going to be no opportunity. People fear they're going to be bankrupting companies and causing people to lose jobs. There are the range of totally legitimate, serious, real concerns to stuff that's off the wall, but ultimately it doesn't matter. It doesn't really matter. You have to be able to engage on any of these to an extent if you're working at it, certainly at a local level, to really make progress.
I think that's very well said. Many policymakers face similarly hard questions, about curtailing movements and shutting down the economy and sort of what that means. Maybe then, Dr. Bernstein, you could leave us with one thought. If all of us were to leave the webinar here in 5 minutes and change our actions in one way, what would that be?
That's a great question. I think I'll bring that question to something that is squarely within my expertise and I think has relevance to people beyond. My day job is taking care of children for a living. And I'm often asked these days what we should be telling children about the mess we're in. And, part of it is, here's what we need to do to keep ourselves safe. We can't necessarily play with friends. We're not going to school. Grandma and grandpa are not allowed over. All of these sacrifices that our children are making, these are things we obviously need to communicate clearly. I think, though, that the important part there that needs to be married to that conversation is, we're not doing this for us. My children are, not probably going to get sick with COVID, and if they do, it's not going to be that bad. Now, that is definitely not true for all children, but certainly for most children, this doesn't look like a particularly bad disease. And so there is a moment where you realize that helping a child grasp that we do things because they're important to people we care about in our community and our families that don't necessarily benefit us. This is a pretty powerful moment to try and communicate that idea. For the adults in the room, this moment along the same lines really strikes at a core belief in our views of health in this country, which is we want to believe that if we eat the right foods and take care of our bodies through exercise and all the things we do as individuals, we're on a path to good health. And there's no question that all of that matters, but it's not really sufficient. It turns out that we, in many ways, are no healthier than the society we live in. And we don't want to recognize that, because recognizing that really calls into questions all kinds of things that we do on a regular basis as to their wisdom. But nonetheless, it's pretty hard to look at what's going on and come to any other conclusion. And so when we start asking questions about, well, why would we invest money in, taking care of the homeless? Why would we invest money in providing more access to healthy diets for children? Why would we spend more money to beef up the surveillance of infectious diseases? There are altruistic reasons to do all those things, but there are selfish ones too. And that's what this makes so apparent. And, you can pick your side on that. It doesn't matter to me, but ultimately we have to acknowledge that the health of the communities we live in our country matter tremendously to our own health. And for that matter, and I'll close on this point, which is we also have to acknowledge that our health absolutely depends on the welfare of the other creatures we share this planet with. I walked into the first room I walked into that I had to dress up like an alien because we were concerned about COVID. And within about 2 minutes of sitting in this room, and I'm used to the question from a parent, which is, what could I have done to prevent this in my child? Because there's no parent I've met who has a child in the hospital who does not want to understand what they could do to keep their child well. And I thought, well, hand sanitizer is helpful if you can get it. Physical distancing, also really important. These critical measures part. But it turns out that none of that is going to prevent this. It turns out that the only way to prevent this kind of problem is to reconcile how we are essentially transforming the living world in ways that are unprecedented. I mean, there hasn't been this much loss of life on Earth in 65 million years since an asteroid hit the Earth and wiped out the dinosaurs. And so we'd like to believe that we're floating above the tapestry of life, that our existence and health is untethered from the web of life we live in. But nature knows better than that. Nature is trying to tell us something here. Nature is telling us that we simply can't operate in this delusion that we are floating above the tapestry of life. And what does that mean here in Massachusetts? That means that what we do in our schools, in our conservation practices, in how we work with other states around wildlife corridors, these are not only critical to the welfare of our population right now, these matter as paradigms that could be spread around the world. And there's nothing that promotes success than an existing demonstrated success. So I'll stop there. Elizabeth, thank you so much for having me. I hope those of you who are listening got something useful out of this. And for those interested in following up, my email address is all too public on our center's website, but it's Aaron_Bernstein at HMS, like Harvard Medical School.harvard.edu.
Dr. Bernstein, thank you so much. I wish that you could hear our applause from all corners of the Commonwealth. And I thought that what you said, that we are no healthier than the society that we live in, is beautiful and a great way to close. I want to thank you so much for joining us. I also want to say that we got a question about whether what you and your intentions were about running for office. I think you'd have some supporters here. As I mentioned, we've planned an exciting 10-week series of webinars on many of the issues that we've covered today: climate justice, the roles of government and policy, ensuring the economic recovery from COVID-19 is clean, green, and equitable, and many more. So stay tuned for the invitation for next week's webinar and the announcement for next week's speaker. You can look for an email from the ELM team that will have links to that New York Times piece that I mentioned, the recording of this session that you're welcome to share with your networks, ways to learn more about the work of Dr. Bernstein and see change, and registration for next week. So with our abundant gratitude, Dr. Bernstein, thank you so much. And I hope that everyone on the line stays healthy and well. Take care.